So now let's talk about something else that you can have in your toolkit whenever you're trying to understand, how your infant is really feeling. And so we want to look on page 4 of the textbook. This is the infant illness assessment. And so anytime your infant is ill, this is a really good checklist to run. And it's an acronym, and it's called TABI. And TABI stands for T, temperature, A, appearance, B, behavior, and I is input, output. And so you think your infant is not feeling well, just not feeling like themselves. Let's go take their temperature. And if the infant has a temperature that's 100 degrees or 100.3 degrees or above, pretty good indication our infant's got some sort of a fever. And so what we want to do is we want to turn to page 11, and we're going to talk about the infant fever flow diagram and how to diagnose our infant. Next is appearance. And appearance is, how does the infant look? Does the infant have a rash? Or does the infant appear to have an irritated eye? If the infant has a rash, we'll go look at the infant rash flow diagram found on page 12. If the infant has some sort of an irritated eye, then what we'll do is we'll go and run the infant illness and injury flow diagram on page 13. Next is behavior. How is the infant behaving? What's their breathing like? Do they have a cough? Are they crying incessantly? Does the infant have a possible head injury because the infant fell earlier in the day? And so, if there's something going on there, then we can go and we can run any one of these checklists that can be found in the textbook. And finally, input and output. And sometimes this is the most telling thing about the infant that will give us a good idea that our infant's just not feeling well at all. And so what we're looking for is changes in appetite. If the infant refuses several feedings in a row, or just eats poorly, or all of a sudden the infant has diarrhea and it's really loose and it's really watery, or the infant forcefully vomits after a feeding. This is not just a dribble, but this is a forceful vomit right after a feeding, or maybe the infant has not been able to keep liquids down for 8 hours. We also want to look for signs of dehydration. Signs of dehydration are going to include fewer tears, or the infant has significantly fewer wet diapers, or you see that the infant has a dry mouth, or the soft spot on the infant's head appears to be the infant has a dry mouth, or you notice the soft spot on the infant's head is sunken in. Next thing is constipation. Is the infant having fewer bowel movements than usual for a few days, or does it appear that the infant struggles in having a bowel movement? And then also on bowel movements, check the poop color checklist, which is on page 5 of the textbook, because poop color can tell us about the infant. Or poison. If you believe the infant has ingested a poison, then we need to call 911 immediately. So for any one of these, especially on input-output, we have any one of these things come up, we need to seek immediate medical attention for our infant. There's also a list on page 4 of the textbook of things that we need to call 911 immediately for. Bleeding that can't be stopped. Infant has ingested a poison, seizures, increasing difficulty in breathing, any change in consciousness or confusion or a bad headache or vomiting several times after hitting their head, any kind of unconsciousness or unresponsiveness, large deep cuts or wounds, inhaling smoke, skin or lips that look blue, purple, or gray, increasing or severe pain. The baby is just really, really uncomfortable and is not getting any better. Major mouth or facial injuries, a near drowning, we want to call 911 immediately. And if you have any concerns at all, If your spidey sense is telling you that there is something wrong with the infant, your spidey sense is telling you, I need to call 911, then do exactly that. Call 911. So this checklist found on page 4, the infant illness assessment flow diagram, is an excellent flow diagram that you can run anytime that you think that your infant is ill.